What if I told you that your headache may be connected to your breathing? Your back pain could be linked to the old stress patterns, and your body has an incredible built-in healing system that most people never fully tap into. Today, we're breaking down the 4 core principles that guide osteopathic treatment and why understanding them could change the way you look at your body, your own health, your recovery, and even your lifestyle. Hey guys, I'm Anna, and as an osteopathy student, those 4 principles have completely changed how I look at my own body, how I look at the body of my patients and clients. There are practical frameworks that explain why some treatments may work and others don't, and how to work with your body instead of working against it. Principle 1, the body is a unit. It literally means that our mind, body, and spirit function as one integrated whole. You cannot really separate them because they always work in unison and one affects the other. This means that you cannot separate physical symptoms for emotional states, stress from muscle tension, or thoughts from physical reactions. When you're anxious, your heart races. When you're excited, you feel it in your stomach. When you're stressed, your shoulders tense up. Think of the body like a 3-dimensional web. Pull on one strand at the end and the entire structure adjusts. This is why quick fixes often fail. You can treat just one part without considering the whole system. We call this tensegrity, which means the body is made of tension elements and compression elements. Compression elements would be bones and tension elements would be muscles and soft tissues and connective tissues. Therefore, when there is a displacement of one element, multiple compression elements or tension elements, if there's much pull on one side, if there's too much bending the other way, the whole system will adapt to facilitate the function. It's pretty awesome, isn't it? This principle explains why massage may temporarily relieve your neck tension, but if it's underlying stress patterns and anxiety and thoughts and monkey mind, despite massage, nothing will change. Your body doesn't compartmentalize the way medical specialties do. It doesn't separate your heart from your lungs or your lungs from your gut or your gut from your brain. Everything influences everything else. Your posture affects your breathing affects your stress levels will affect your digestion will affect your mind will affect your healing. Principle 2, structure and function are related, or structure governs function. Simply put, how your body is built affects how it works, and how you use it will change how it's built over time. Poor posture doesn't just look bad, it actually changes how your body functions. Sit with your head pushed forwards and your neck muscles will work over time to pull the head back up. These aren't just cosmetic issues, they're functional problems. But here's the empowering part. This works both ways. Improve your structure through exercise and stretching or manual therapy, and you improve how your body functions. Change how you move and how you breathe, and over time, you will literally reshape how your body is structured. This relationship isn't perfect. You can have structural changes without symptoms and pain without any obvious structural problems. But understanding this connection helps explain why movement is medicine and why posture matters more than just appearance. Principle 3, the body has self-healing mechanisms. Cut yourself and the wound heals. Break a bone and it repairs itself. Get an infection and your immune system fights it off. Your body is constantly working to maintain balance and to repair the damage. And this is called homeostasis. Your body automatically regulates blood pressure, body temperature, blood sugar, the thousands of other processes without you thinking about it or controlling it. This healing and self-regulation happens 24/7. But here's what's crucial. The healing capacity can be suppressed or enhanced. Chronic stress, poor sleep, inflammatory diet, inflammatory foods, lack of movement, environmental stresses, environmental pollutants, all the people that stress you out, or all the things in life that causes anxiety, all the things you're worrying about in life. These all interfere with your body's natural repair mechanisms. In clinic, we are not trying to fix people. What we do is we trying to identify and remove the barriers to the natural healing process of the body. Sometimes the barrier is physical, like restricted movement, poor circulation, tight tissues that we can actually influence through guidance and through treatment. But sometimes it's lifestyle, it's stress and sleep and nutrition. This principle puts you back in a driver's seat. Your body wants to heal itself and it wants to function well. Therefore, it gives you all the signals, the pains, the discomfort, the aches. Those are the messages for you to take control of your own health and your own well-being. Your job is to create the conditions or change the conditions to allow the body to do what is designed to do. Principle 4, rational treatment, is based on understanding the first three principles and using them, feeding them into the treatment plan. Instead of just treating symptoms, osteopathic treatment asks, how can I address the whole organism, the whole person, from mind to spirit to the body? This is why osteopathy often combines different approaches. Hands-on treatment to address structural issues, but also movement, prescription exercise to improve function, and lifestyle advice to support healing. So instead, just giving you exercises for back pain, an osteopath may also look at other aspects of your life, of your routine, look at your breathing pattern, look at your lifestyle, your setup at work, your sleep quality, your stress levels, and not because they want to make things complicated, but because we understand that everything in the body, everything here and here, it's all linked. This principle, it's about working with the body's natural intelligence rather than against it. We want to know it all so we can have a full picture of what changes we can implement to help your body heal itself. So we simply just create a little window of opportunity, but you have to continue by stepping through that window of opportunity and trying to alter your environment, your stress level, thinking of your mind and your spirit, your feelings, your emotions, the way you hold yourself, your activity levels, so you can help the body get better. I'm sure you know someone who, got rid of a relationship that wasn't working for them and they started feeling better. Maybe they took up the hobby that really changed the way they feel. Maybe they started putting different information and content in their mind. Maybe they changed their diet and things changed. What I love about these principles is that they're not just for osteopaths, they for each one of you. They for you. And instead of asking what hurts, you can ask, what's the bigger picture? What might be connected? What may be contributing to this? Maybe you will see certain patterns in your body or in your life. How can I support my body's healing? These principles have guided osteopathic practice for over a century, and they're more relevant than ever in our quick fix culture. Remember, your body is on your side. Physiology, pathology, osteopathy, healing, rehab, longevity are the topics that really fascinate me, and I will definitely be posting more about the different aspects of it. So subscribe for more content, and if you found this interesting, you may want to come back to the video I posted about the mystical origins of osteopathy. I will see you next time.